Is Jenny going to be opening or?
Jenny is going to open, but I think she has not arrived at her better connection. So one of our team, Jenny Roberts, is going to open us in a good way this morning. However, she was having extreme challenges with her internet connection, so she's actually relocating, and she will be here shortly. But so I think maybe I'm wondering, is there anyone else here who would feel comfortable opening us up in a good way, or we can, when Jenny comes, she can say a few words. I see that there's a few people online, and if you don't, that's okay, and we will wait. We will just briefly start some of the housekeeping things, and then as soon as Jenny's here, she can open, and I'm sorry for that. We had a plan and it went sideways. All right, so Tiffany, if you want to take over, that's great. And then when Jenny gets here, we will do that. Or maybe it would make sense, seeing as I'm talking for just this 1 second, just to mention that BCACCS is honored to be co-hosting this with the Ministry of Education and Childcare, and that today we're joining you primarily from the overlapping and unsurrendered territories of the Musqueam, Squamish, and Tsleil-Waututh First Nations, where our head office sits and many of our staff reside, although not all. And I know when Jenny joins, she'll let you know about where she's joining from. So sorry for that misstep this morning.
No worries. Thank you so much, Kirsten. I'm actually going to pass it off to Nayla and Jen, who will be leading the presentation from the ministry side today, and they can introduce themselves.
Thank you, Tiffany, and thanks everyone so much for joining the discussion today. We're so excited to be here with you and to have the opportunity to share some information that we hope is useful to you. And we're very grateful to BCACCS for hosting this session for us and creating the space where we can come together. My name is Nayla Moffat, and I'm an acting manager with Childcare Policy in the Ministry of Education and Childcare with the province of BC. And I'll be co-presenting with my colleague Jennifer Paz, the director of the Childcare Operating Funding Program. And we also have some other ministry staff who are joining us to help with any questions you have, which we're hoping to get to and leave lots of space for at the end of this presentation. I'll also just mention that if you have any really specific questions about your community or your childcare facility that may not be relevant to others, you're welcome to raise them, or you can contact us directly at the program area, which we will include the contact information for the program in this presentation as well, if you'd like to go that way with it. So thanks again to BCACCS for hosting us and for their continued leadership and work to support First Nations, Métis, and urban Indigenous-led childcare providers in BC. We're very excited to have many of those Indigenous early learning and childcare providers join us today and share some information with you about the Childcare Fee Reduction Initiative. I would like to start by acknowledging that I am calling in from the traditional territory of the Lekwungen peoples, also known as the Esquimalt and Songhees Nations. It's a very beautiful day in Lekwungen territory today. And I saw some folks sharing their territories in the chat as well, but please, we know where you're calling in from across the province, so please feel free to do that in the chat. Oh, and I see Ellie is letting me know that Jenny is here. Perfect timing.
Jenny, can you please open us in a good way? Sorry for the delay, everyone.
Oh. Aswell, Chalapalopits, Telscree, Talitziquat, Shackle, Casta, Halfstone, Buffalo Woman. I would like to open us up in a good way. So if you have a good thought in your heart and in your mind, so let's thala, we will start us in a good way. O Chichel Siam, please to skepsit. A quam quamcha, Talia Talua, Quaset Makolak, Chithomitsit, Lam Kmokstam, each Mokolak, A Questas, Muktelskaka. Today, Creator, I am asking for blessings for those that are grieving at this time, Those that have left us and are sending their way to the other side, I'm asking for extra prayers for them and their families as they go through this grief. Creator, I'm also asking that you watch over our little ones, that they know that they are loved and cherished and very important to all of us. And Creator, I ask that you watch over those mothers that may be going through some hardships at this time after giving birth, that they know that they can reach out and that people will be there to support them no matter what. And Creator, I ask that you watch over the ones that have lost their way and that they come back to the good way, that they know that their families are loving them and missing them deeply. All my relations, Muktaskaka.
Thank you so much, Jenny, for opening us in such a wonderful way. That was very, very good to hear this morning. Thank you. So I'm ready to, as I mentioned, the contact information for the Child Care Service Center is on your screen. And if you have any of those very specific questions, you're encouraged and very welcome to contact us there. And also we're available during the session to answer any questions that you have towards the end. So we're looking forward to hearing what you might want to ask and hoping that we have the answers for you. So in today's presentation, we're going to start by sharing some background information about the Child Care Operating Funding Program, and then we'll share some more detailed information about the fee reduction initiative, including eligibility requirements and funding support available. Then we'll walk you through the application process, and at any point during the presentation, you can submit questions through the chat. We'll also take live questions through the raised hands feature at the end of the presentation. So if you'd like to speak your question, please hold on to it to the end and we'll look to answer it at that time. And I will pass it over to Jennifer, the Director of the Child Care Operating Funding Program, to tell you a little bit more about it.
Good morning, everyone. I also wanted to thank you, Jeannie, for those powerful words to start us in a good way this morning. And with gratitude, I acknowledge the Lekwungen peoples on whose unceded territory I live and work and raise my own children. So to start us off this morning, when we talk about the CCOF program, it's a bit of an umbrella term that covers 3 distinct funding streams. So, and these funding streams are eligible to licensed group, multi-age and family providers. We have base operating funding, which assists licensed childcare providers with the day-to-day costs of running a facility. We have the Child Care Fee Reduction Initiative, which reduces and stabilizes parents' childcare fees. And we have the Early Childhood Educator Wage Enhancement, which recruits and retains a skilled and qualified workforce. So just a little bit more about the CCOF program. All 3 are a demand-driven application-based programs. Applications for CCOF are processed continuously throughout the year, and they require childcare providers to enter into a funding agreement with the province. We accept them all throughout the year, so at any time, our fiscal calendar starts April 1st, but at any time you can send an application, we'll review, and then we will enter into a funding agreement with providers. Funding is provided on a monthly basis and typically starts from the 1st of the month in which an application is received. And they expire at the end of the fiscal year, and you can renew annually if that's your choosing. Participation is optional. However, enrollment in the CCOF base program is required for the CCFRI, Child Care Fee Reduction Initiative, or the ECEW. And facilities are listed on the Child Care map online, and they can also access other programs such as the Child Care BC Maintenance Program. So to describe a little bit about the basic eligibility, I'd like to refer back to the umbrella concept, or maybe better put, a triangle concept of basic eligibility. So to be eligible for the Child Care Operating Funding Program, the base funding portion, the Child Care program must be licensed and in good standing, agree to provide services to families receiving the Affordable Child Care benefit, make every reasonable effort to provide an inclusive and supportive environment, and they must complete the annual provider profile survey. For the Child Care Fee Reduction Initiative, or what I'll probably refer to for the rest of this presentation as the CCFRI. Providers must be enrolled in CCOF, and they need to offer care in one or more eligible care categories and charging fees within the prescribed or approved amounts. And we'll discuss those eligible categories over the presentation. And then last but not least, the Early Childhood Educator Wage Enhancement Funding Program. The basic eligibility is that the provider must be enrolled in the CCFRI, or they need to participate as a $10 a day childcare BC center. So that was the base funding. Another really important funding stream that we have is the ECEWE, the wage enhancement. For those who aren't aware of this funding, we want to make sure wages and working conditions are competitive to retain current educators and attract people to work in the sector. So to do that, early childhood educators working in licensed childcare facilities are eligible to receive a $4 per hour wage enhancement on top of their wage. And for those that are already enrolled or aware of this program, I thought I'd take this opportunity to talk about some of the changes to this program occurring this year. So as of September 1st, facilities offering care to children in preschool and or school-age children, grade 1 to age 12, must be enrolled in the CCFRI in order to be eligible for the ECEWE. Previously, CCFRI eligible facilities have been required to participate in this funding so those that previously and wanted to be eligible for the ECEWE needed to have CCFRI eligible care categories in order to be eligible. However, those that didn't have eligible categories were previously exempt. This year, as all categories are now eligible for the funding starting on September 1st, this requirement will apply. Facilities not approved to participate in CCFRI as of September 1st will no longer be eligible to participate in the ECEWE. And the exception to this is providers who offer no fee childcare. And we recognize that many Indigenous early learning and childcare providers fall under this category. So if your facility would still like to continue receiving the ECEWE and you do not charge a parent fee, please apply, and our ministry staff may reach out to you to confirm the reason of opting out of the CCFRI before approving the application. And with that, I'll pass it on to Neela again to discuss the Childcare Fee Reduction Initiative.
Thank you, Jen. And yeah, regarding just low and no fee childcare providers and participating in the CCFRI, we do have some information about that in this slide, in this presentation. So I will touch on that in a little more detail a bit later on. But to start, I'll just share that the focus of our presentation today is on the Childcare Fee Reduction Initiative, which is a voluntary program intended to help licensed childcare providers reduce and stabilize parent fees for families. Participating providers receive funding on a per child per month basis, comprised of fee reductions of up to $900 per month and a provider payment to support operational costs and continued participation in the program, which can be up to $96 per month per child. So this is on top of the childcare operating funding, the base funding that Jen was talking about. And over 90% of childcare providers who are eligible for the CCFRI participate each year, supporting over 76,000 families. So the next slide is basic eligibility. So to be eligible for the fee reduction initiative, childcare providers must offer licensed childcare in an eligible category, which are listed here on the screen. And starting September, as Jen was mentioning, this is expanding to include school-age care and preschool. To be eligible, childcare facilities must have a childcare operating funding agreement in place, so they must be in receipt of the base funding. They must align their parent fees and any parent fee increases with prescribed amounts, which I'll talk about a bit more later. And the CCFRI is by facility license. So all of the care categories on the facility license must be approved to participate for any one category to receive the fee reduction. So on the next slide, we'll talk about eligible Indigenous early learning and childcare programs. So if your childcare program is accessing other operational funding programs, this may impact your facility's eligibility for the fee reduction initiative. So childcare spaces that are fully funded by the provincial Aboriginal Head Start childcare programs through First Nations Health Authority or AHS ABC, they're not eligible for the childcare operating funding or the childcare fee reduction initiative because these spaces are fully funded. Starting September 1st, as we mentioned, the fee reduction will expand to include preschool. And so Aboriginal Head Start preschool programs that are federally funded and licensed are eligible for the CCFRI. Any licensed Indigenous-led childcare facility that is not part of the Aboriginal Head Start childcare program, the fully funded provincial ones, are also eligible for the CCFRI. And we recognize that there are facilities where some spaces are fully funded under the Aboriginal Head Start childcare program by the province, but not all spaces are Aboriginal Head Start. So providers can apply for the CCFRI for those spaces that are not in receipt of Aboriginal Head Start childcare funding. Childcare spaces that are fully funded, just back one, thank you. Childcare spaces that are fully funded by the provincial Aboriginal Head Start program, this is a repeat, are not eligible because they're fully funded. I apologize, I duplicated my speaking note. Okay. Next, I'll pass it back to Jennifer to talk about where to start.
Great, thank you, Naila. So the best place to get started on an application is just to go to our webpage. The link is located there, which I believe you will receive as well after this presentation. But within the Childcare Operating Funding webpage, we have a tab called Apply or Renew webpage. And that's really kind of your one-stop shop where you'll be able to find anything that you'll need with regards to setting up or continuing an application to renew your funding with us. I would highly recommend that as a provider, you bookmark this page so you have it readily available as really pertinent things like the funding guidelines, both for CCFRI or ECE are located there. There's also a review of the basic eligibility requirements for CCOF base. We have the CCFRI estimator, which some of you may be already familiar with. And that's a great tool to estimate the amount of CCFRI parents will be receiving, or as a provider that you'll need to provide to parents. We also have the My Childcare BC Services platform. That platform is the location where the application is based. So again, critical information can be found on this webpage. And in terms of setting up an application, just to walk you through the steps, you put in your intent to apply, you upload at a very high level your license information, your business information, and then you get to the CCFRI application portion. And the most important piece of information that you can provide our program is your highest full-time daily or monthly parent fee, exclusive of any optional fees. So at this point, we're not monitoring or we don't want to know, your rates with optional fees included. But without them, what is your highest full-time daily or monthly parent fee? And it's this fee that we use to determine the eligibility for the CCFRI. So for an applicant that's applying for the first time, we take this number to determine whether the parent fees are set below or at their regional 23-24 affordability benchmarks. And if you're a renewing provider, we use this number to assess whether any planned fee increase is at or below the annual fee increase limit for the region within your facility. For those providers that offer part-time care options, because the full-time daily and monthly fee is used to determine the CCFRI, it's really important that in order for your facility to receive the maximum fee reduction amount, if you only offer care for 4 hours or less each day, that you calculate the parent fee that you would charge for more than 4 hours of care. Otherwise, you may not be receiving the full amount of funding that you could be. If you only offer care for 4 hours or less per week, or for 4 days or less per week, We highly recommend that you report your daily rate. And so again, just reiterating that the importance of this is that reporting a part-day or a part-time rate may actually lower the amount of CCFRI that parents are eligible to receive. So at best, we'd like to know what your full-time daily rate or what your full-time daily fee is. And in the case where you offer part-time care, if it's 4 hours or less, calculate it as if it was more than 4 hours. And if you only offer care 4 days or lower, give us your daily rate so that we can calculate the appropriate amounts. Okay. So you've given us your license, your business information, you've told us a bit about your fees. We also ask a bit about your facility closures and what do we do with this information. So once we have everything that a complete application, the ministry is looking at a couple of things. So the first one is your facility closures. So facilities may charge full monthly parent fees for closures of up to 2 consecutive weeks per month or 4 weeks per year. There are limited exceptions to this, such as closures that align with the school calendar. But that's a key piece to the application, is just making sure that the facilities closures don't go over those amounts. And then the next thing we look at are those fees again. So for new facilities, as I mentioned before, we look at the initial fees. So is that amount at or below the affordability benchmark? Again, limited exceptions to this as well, including preschool or school-aged care from grade 1 to 12 12-year fees from September 23 to 24. More information on that can be found in the 23-24 funding guidelines that I mentioned can be found on our website for apply or renew. And then if you're a renewing provider with us, we look at the amount you give us as your parent fee to determine any parent fee increases. So annual fee increase limits are based on 3% of the regional median fee. These amounts can also be found in the CCFRI funding guidelines. And as usual, there are also limited exceptions to this, up to a maximum based on 10% of the regional median fee. And those amounts can also be found in those CCFRI funding guidelines.
Thank you, Jen. I'll speak to this slide, which I know is a lot of information and a lot of numbers, but I'll walk you through the columns, and then, hopefully really what we're trying to illustrate is that last column, which is the total funding available per child per month. So starting on the left is the type of license, the provider type, we call it. So if your facility has a group or multi-age license, or a family or home-based license, in-home multi-age, et cetera. So those are the categories of license type, and the funding rates correspond to those categories. So then there's the rate category, which is also related to the license type. So for younger children under 36 months, all the way up to school-age children, grade 1 to age 12, again, corresponding to the type of license that you hold. So the middle column is the fee reduction amount for those families. So we always use $900 a month because it's the highest, but in a group setting for a child under 36 months, the fee reduction, the maximum is $900 per month per child. Following along that first row, the provider payment for this type of care is $96 per month per child. So when you combine that, the total payment that childcare providers receive for each child each month is $996 for that type of care. And then you'll see all the other amounts kind of correspond to the age of the child and the setting that the childcare is provided in. And these are full-time rates as well. So as Jen was saying, part-time amounts they're prorated. The fee reductions and the provider payments are prorated for part-time care. And that's part of what's so important about declaring an equivalent full-time fee on your application. So in the next slide, I'll show you an example of how savings work for families. So once a facility is approved to participate, they will receive monthly funding to reduce parent fees by the amounts that we just talked about on the previous slide. In this example, where a group provider is charging $400 per month for full-time before and after school care, parent fees will be reduced by $115 per month, and families at the end of the day will pay $285 per month. Another example is if a preschool provider charges $325 per month, their fees will be reduced by $95 per month so that families only end up paying $230. These are just examples, of course. Actual out-of-pocket costs to families depend on the fees that their provider originally charges. Additionally, families may be eligible for the Affordable Child Care benefit, which can help with that remainder of the parent fee once the CCFRI has been applied. And for part-time care, where children access care for where children access care for less than 4 hours a day or less than 5 days a week, once again, the fee reductions are prorated. So these amounts are the full-time examples. And then on the next slide, we want to introduce this concept of the minimum parent fee, which you may have heard of. In general, the fee reduction does not reduce fees below $10 a day or $7 a day for part-time care. If the maximum parent fee reduction reduces the parent fee to less than these amounts, the CCFRI amount is typically reduced so that we're not reducing fees below $10 a day or $7 for part-time care, which I'll show you an example on the next slide and it'll make a lot more sense. But setting these minimum parent fees means that parents with children at some CCFRI facilities will pay the same amount as parents enrolled at $10 a day childcare BC centers. And this is to align with government's vision of $10 a day childcare as a core service. However, providers who currently charge below these amounts will be supported to continue doing so because families should not pay more as a result of their provider participating in the CCFRI. So the next slide is an example of how the fee reductions would be reduced so that families are not paying less than $10 a day for full-time care or $7 a day for part-time care. So in this example, the fee reduction for group before and after school care has been adjusted from $115 to $100 per month. And the fee reduction for preschool has been adjusted from $95 to $85. You'll see the total fees after the reduction are $10 a day or $200 per month. Or for part-time care, they are $7 a day or $140 per month. But as I said, any facility currently charging less than these amounts after the CCFRI has been applied will be supported to continue doing so because we don't want families to pay more as a result of their facility's participation in the fee reduction initiative. So we are aware that some Indigenous-led childcare programs offer low and no-fee childcare to reduce barriers for families accessing childcare. Low and no-fee programs can still enroll in the CCFRI to support with operational costs. So to participate, providers must indicate a parent fee in order for us to calculate your payment. As Jen was referencing earlier in the presentation, the parent fee is used to calculate payment. So that's why we need something to reduce by as part of the calculation. But childcare providers are not required to charge families more out of pocket to participate. So because we require that there must be a fee of some kind to reduce, we do have a policy that allows facilities that have historically provided low or no fee childcare to Indigenous children and families to indicate a monthly parent fee of up to the amounts listed here. Low or no fee childcare providers seeking to set fees above these amounts may be asked to explain the reason for the increase to their fees according to the policies in our funding guidelines, which Jen also mentioned is available on our website. But this is just to show you at a glance the kind of maximum parent fee that you could set under our policy to support your operational costs if you have been historically providing low or no fee childcare to Indigenous children and families. I'll pass it back to Jen to talk about some key dates.
So there is a lot of information there. Completely appreciate that. But to finish off this presentation, we thought it would be great to highlight some of the key activities and timelines over the next few months. if you are renewing or if you're a new provider interested in our funding under CCOF. So August 15th of this year, providers can pre-claim for September 1st. That date's important with respect to the new care categories of preschool and school age, so grades 1 to 12 years old. So that's an important key date. September 1st is the official date in which the school age and preschool providers that are approved for the CCFRI program can begin reducing fees for families. September 30th is the last day to apply for funding beginning in September, if they haven't applied yet. In early 2024, for those providers that are going to be renewing with us again for that year, we have our applications that open typically in January. And then April 1st, 2024 seems like a really long time away, but it'll probably creep up on us pretty quickly. At least it feels like that from a program end. That's the first date that the 24-25 funding term begins. And so that would be looking for funding. And again, we anticipate that we would be using the same webpage, the apply for or renew webpage with updated funding guidelines, updated policies, if applicable, and our platform, My Child Care BC Services, would be housed for those that are interested in renewing or applying for us with us again. And then lastly, but most importantly, what happens after this presentation. So again, I can't reference enough that a lot of our information can be found on our website. And again, you will have these resources available to you after the presentation. So our website is a great area. In the contact center, the Child Care Service Center, we would be more than happy to assist with any questions or anything that you may have to provide us. So if you are an Indigenous-led childcare center, and you can inform the person who takes your call that you are contacting from an Indigenous-led childcare center, they will put you through to a specialized individual who can provide added support to your application or look into the status of your application or whatever support is needed to get you on the right path. And our hours are from 8:30 a.m. to 4:30 p.m. Monday to Friday. Our phone number, as you can see on the bottom, but I'll just speak it out loud, 1-888-338-6622, and we're option 2 on the phone tree. But again, this information will be provided in material print, so no need to write it down. And our email is ccof@gov.bc.ca. And ways to stay in touch after this presentation include things like our Childcare BC Bulletin. If you're not signed up for it already, I'd highly encourage you to do that, as there's a lot of really important information, not only around the CCOF program, but about new initiatives within the childcare division, or other pieces of information around anything childcare related that might be of help or service. We have Indigenous engagement opportunities as well. And last but not least, there is an email there provided, childcare BC engagement@gov.bc.ca. Should you want to go through any wider aspects outside of CCOF, we would encourage you to use that as a medium to vocalize any concerns or to provide any feedback. So we certainly hope to stay in touch beyond just this hour-long presentation, that's for sure. All right, and that concludes our presentation. We'd like to open this period of time for any questions, but I will perhaps hand that to Kirsten.
Hi. Or Ellie can help me see if there's raised hands. I'm not sure if Penelope's still on the call. I was just trying to figure that out. She had asked a question in the chat about, will ECE wage enhancement be on top of the provincial funding? Oh, here, there you are, Penelope. Feel free to unmute and ask your question directly. You had asked. Yes, or you can also drop any questions in the chat box. There's Penelope. There you go.
Hi. Yes, I was just wondering, because of the wage top in the province, can the programs access that and this wage enhancement? Hello?
Sorry, I know for me, you cut out there a little bit at the beginning. I'm not sure if others from the ministry side heard the question.
So my question was, will the provincial wage enhancement that programs receive and this wage enhancement that you're talking about today, can you apply for both or just one?
I'm not familiar with the provincial wage enhancement. I'm wondering if anyone on the call might have any other information. If my colleagues maybe in policy are aware of one. I'm not sure if maybe it could be even one and the same. The provincial, or at least the early childhood educator wage enhancement is the $4 top up currently with ECEs. I'm not sure the provincial funding that you're referring to, Penelope, what that looks like, but perhaps, as I mentioned, perhaps other colleagues from the ministry side know more than I do on this topic.
I believe that that's what Penelope is referring to. I think she's the CCFRI. She was, I think, thinking that that was also a wage enhancement. It's more of a funding to support a reduction of the childcare fees. Penelope, is that what you were wondering? Can you access the CCFRI and the ECE-WE wage enhancement?
Yes, that's my question. Sorry, I lost you there for a minute.
That's okay.
Hi, Penelope. My name's Teresa Butler, and I'm the acting executive director here with the ministry for childcare policy. So I think I can help Jen a little. Yeah, the ministry only funds one wage enhancement. That's the $4 an hour top up for frontline early childhood educators. Yes, in addition to that, facilities can apply for the childcare fee reduction. And as part of the fee reduction, you're going to get a piece of funding to reduce the fees by the prescribed amount. You're also going to get a piece of funding we call the provider payment. And that's what Nayla was referring to earlier. And that provider payment is essentially an operational grant that providers can use to cover off the expenses associated with delivering childcare. So that could include a wage enhancement if the provider so chooses, but that's up to your discretion in terms of how you use that provider payment portion. But really it's intended to supplement and support childcare providers that are enrolled in the fee reduction initiative with their day-to-day operational costs. So I hope that helps.
Yes, it does. Thank you.
Thanks for the question, Penelope.
Thanks, guys. I don't see any more questions in the chat, and oh, maybe there's one. Hold on. Michelle, did you want to speak to what you've written down?
Hi.
Hi, Michelle. Thanks.
Yeah, I was just invited to this meeting by my coworker. She's doing incredible things for our community, and we are very lucky to have her. She's getting a daycare. She keeps calling it a Head Start, and I don't know if there's a difference between like Head Start and daycare, but we are looking to get licensed workers and a brand new building set up. So she invited me to attend this meeting for her. She's busy. And I was wondering if we need to have the building, the licensed workers, and the children signed up and everything before applying for this program.
Thanks for your question, Michelle. I can speak for the CCOF program portion of the question, and then perhaps with respect to the Head Start aspect, perhaps one of my colleagues can jump in. So no, you don't need to have your licensed workers and your children attending prior to applying for CCOF. we typically use the license start date. I mean, really the date that matters for the point of starting the funding is just the date that we receive a complete application. And usually the only piece of information that we require at that time is just your new license. So once we have the license, the application, then we can go ahead and start funding at the 15th of every month prior. So for example, if we were taking July 15th, so if your facility started April or August 1st, you could on the 15th, if you had all your enrollments in, you would just fill in a report that speaks to how many children are attending. We don't require detailed information around the children for the purposes of providing the funding. You would just include it in your report, and then we would receive the report that you had, 7, 8, 100 children, and then we would provide you the funding accordingly for your August funding. And the provider payment that Teresa was speaking about, all of that gets calculated into that one report. But I hope someone can jump in for the Head Start, as there is a slight difference between that and CCOF.
Yeah, so I'm going to jump in here, and good afternoon, Michelle. And I'm Tam Scott, and I'm the manager of Indigenous Child Care Policy. And just want to clarify between provincial Aboriginal Head Start and federal Aboriginal Head Start. So if it's a child care program that's full day child care that you'll be offering, then that's considered that would be funded by the province. And so there's not eligibility for CCOF or CCFRI or the ECEWE. And the reason for that is because it's considered single source funding, we call it, which means that all of that funding is bundled into Aboriginal Head Start funding. Depending on where the site is located, then that would be either through First Nations Health Authority or through the Aboriginal Head Start Association. And I know that Aboriginal Head Start Association is currently working on some capital builds, so building new childcare from the ground up. So if that's what you're doing right now, then there is the possibility that it is provincially funded through Aboriginal Head Start Association, so chances are there's not eligibility. It will be built into the Aboriginal Head Start operating funding.
Okay.
And I'll maybe jump in here, Michelle, in regards to your comment about an email contact. I'll put the email into the chat. But if it is an Aboriginal Head Start childcare program, like Tam said, it wouldn't be eligible for a CCOF, but I'll provide you both the childcare operating funding program email as well as our childcarebc.engagement email. And if it's a broader question, you can feel free to reach out to the engagement inbox.
Okay, so because nothing has been started yet, like this is going to be, it's going to come up pretty quick. We have a lot of building, like adding addition to reserve projects on the go. But so if it sounds like they both have enough funding to help parents with the costs. So I'll just make some notes, and then I'll probably get her the email so that she can ask additional questions later. I've been taking notes the whole meeting though.
Wonderful, Michelle. And I'm just going to jump in and say that our childcare advisors at BCACCS can also support you. It sounds like you're fairly early on in your community goals, and so we can support you to figure out a few pieces of that as well and get you connected, if you're not already connected, to the Indigenous Early Learning and Childcare Framework facilitators, so at BCACCS. So we'll send you an email after this to follow up with you.
Okay, thank you.
Yeah. I don't see any more questions in the chat, but is there anybody else who would like to have a question for the ministry while they're here? Diana.
Hi there. Hello, everybody. So we are already participants of the childcare fee reduction initiative. We have our group childcare in our kindergarten. This is getting extended to all our school-age children. So my question is for for us providers, you know, reconciliating these with enrollment reports and the attendance sheets, and it is quite a task, and that's okay. We are all getting used to the new system. Now, my only concern sometimes is the payment confirmation, because when we are trying to generate a payment report in the website, right, through my childcare services, and so it is a little vague, right? Like we don't know exactly how much funding we're getting for the children, plus the administrative top-up fee, which is really appreciated because it does take a lot of much more administrative work for us to do these reconciliations, you know. But I just wonder if there is going to be a way that this confirmation of payment can be improved, so childcare providers, we know we are just right on track, which what we are receiving from the ministry and what we are charging our parents. I am not at $10 per day. I mean, my fees are I quite lowered the benchmark. So in my kindergarteners this year, for example, yes, we were at $10 per day. They were only paying $200 per month, the full timer. So I mean, I'm loving the program, but as a single-handed manager, having to deal with everything we're doing, I have like 120 children. Reconciliating all this at the end of the month is hard. There are some months are 19 days. Some months are 23 days. So some months we feel, okay, we're losing money because the month is a 21 day per month. But then February, for example, it's shorter. I mean, there are still things that on the day-to-day basis are really hard for providers to reconcile with the ministry. Are we going to, are we working towards something like more kind of flat, a little bit more straightforward, or we are staying like this on a daily basis? Months are March, for example, was at 23 days per month. So like, do you understand there are a lot of inconsistencies still on the program, even though I know we've done, the ministry and childcare providers were doing all the best we can, but there are still some things that we can probably improve for the years to come. That's my feedback.
I have thank you so much, Diana, for that feedback. And I just had a clarifying question to help me understand some of your feedback. I definitely heard about the payment reconciliation and wanting that to be improved and how much work it is, we know, to report enrollments on a daily basis, rolling up on a monthly basis. You had said with the different number of days per month, like for March, for example, was your question about reconciling like the fee reduction amounts for families based on different days per month, or just overall, your payments are different every month because they're based on the number of days?
Kind of, yes. I mean, I find that our payments are different per month based on the number of days. And I mean, yes, it can change. It can change. I had a big problem during March because we are allowed to close up to 2 weeks. Our group childcare closed because of a space, physical space, like we do before and after school care program too. So and then we did have a hard time reconciliating our March because of the program confirmation last year. Like we do our program confirmation in April, then you cannot touch that program confirmation anymore until next April. And there were some problems in there with the fees because these further reductions came in December to play. So we had calculated already a year in April, and then come in December, oh no, we were asked to increase those reductions. And that totally, I'm a non-profit, by the way. I mean, we're not doing, but then it was, for us, March was a very difficult month because the way we submitted our enrollment reports and the way the government reimbursed us, that reductions didn't match at all. Because on the April, we did the confirmation program in April 2022, the changes come in December 2022. So it was already too late for us to fix this problem. I mean, we tried talking to the ministry, we sent a couple of emails, we ended up losing quite a bit of money, which is, it is predictable in any business, but I wonder if these little things can be improved or looking after for the years to come, if we want the success and the operators to keep on complying with the complexity of this process. It's a complex process. With all my respect and the way I love the project. I absolutely love the project, but it's a complex project for medium to big size. The childcare here is, we are about 130 children, so I consider we are a medium to big size childcare program. So the process can be very complex.
Thanks for your feedback, Diana. And I just want to say, please don't ever apologize for providing feedback. Certainly that's how we grow and that's how we learn. And that's how we, I hope, make improvements to the program to reflect that feedback, both from an operational perspective as well as from a policy side as well. So please never apologize. I'm wondering though, just because you listed a number of concerns, maybe you and I can touch base and we can organize a call. I think there might be some areas where we could provide some additional support that might be helpful for you in your, and then as well for us to clarify some of those points of feedback so that we can, action them where possible and look into those for future implementations into the program. I don't know if you're open to that, but I
would love it.
Oh, great. Awesome.
I've been teaching myself, and as a prophet, I've been teaching myself to do this. I mean, we do have an accountant. She's not very hands-on. So at the end of the month, I've been having to say, okay, this is my enrollment. This is what I invoiced the ministry for the space. So if somebody can talk to me in private and not taking anybody's time, I will really appreciate it. That will mean a lot to me. Thank you.
No problem. If you don't mind sending an email, Diana, to the ccof@gov.bc.ca, so I have your contact information, I'd be happy to set something up. I don't pretend that this is a very simple program, but I think there might be areas where we can at least work together to figure out if there's some ways that we can provide you with some tips or anything like that, right? So
thank you.
Yes, please don't apologize. And also, in terms of, I don't want to speak for other colleagues, but we're also very open to, providers that want to provide that feedback for future initiatives. Certainly we have, I believe, Tiffany, I don't want to speak on your behalf, but I believe we do have opportunities for providers to provide feedback on things. So continuous improvement is something that the ministry strives for every day. And so I just want you to be aware of that. And for anyone on this call, please never hesitate to provide feedback, as this is here to support you guys who are doing the important work. Yes, please always provide that feedback, good or bad. We will work with it and look to see what we can do better as well.
Thank you so much. I really appreciate it. It's all positive, only positive, but help us a little bit. Yes. Some of us are just like really teaching ourselves. So thank you.
So thanks everyone for all of your feedback. And I don't know if anyone from the ministry team wants to say anything in closing, but we should maybe give it to Jenny afterwards to do our closing. So I'll give it back to your team and then you can hand it to Jenny.
I'll jump in and just thank everyone so much for taking time out of your busy days to spend with us and to listen to us talk largely. I hope that some of the information in this presentation was valuable to you, and as Jen couldn't have said it better than Jen did, that we really value your feedback and we know that you're doing the very important work out in your communities, caring for children and families, and we are here to support you. So thank you so much for your time, and I would very gratefully pass it to Jenny to close us in a good way.
Oh, yeah, Kwasai, thank you so much. If you again want to, have pray in your own way, pray in the way that you need to at this time. Kathy Kusai to Chichel CM, what Casta Mamala, Kathy Kusai to Chichel CM to Siwas to Sialakwa, Casta CC to Chichel CM for the world. I thank you, Creator, today for everything that we have. Thank you for the children. Thank you for the elders that we have around us. And I want us to make sure that we embrace everything that we're getting today, that we take what we need and leave what we don't. And thank you, everybody, for being here and being a part of this in a good way. All my relations, Muktelskaka.
Thank you very much.
Thanks, everyone. Have a wonderful